Hello, and welcome to this webinar about the SEN and Disability Single Route of Redress National Trial. This is being recorded in March 2020 and is a webinar of some briefing events that we have been holding around the country in different regions, but because of the current coronavirus issue, we have postponed a couple and have produced this webinar instead. So welcome. I'm Andre Imich. I'm the SEN Disability Professional Advisor at the Department for Education. The key aims of this event or webinar, well, firstly, it is beholden upon us to remind ourselves of the purpose of the Single Route of Redress trial and the duties and support that are expected. We also want to use this as an opportunity to share statistics and some of the key learning since the trial launched almost 2 years ago. We also will be looking to highlight some of the common issues arising from the first couple of years of this trial. And if you're in groups, you might be able to find an opportunity during the webinar to discuss and share your experiences. One of the presenters will be one of the lead judges at the SEN Tribunal, who will present the tribunal perspective on how it's gone so far and some of the issues they feel are pertinent. And finally, we would wish to encourage you to disseminate the information from this webinar and associated materials to your colleagues and other networks. So, before we get into all of that though, I think it's important just to provide you with a brief update on the SEN Disability Review that the department is undertaking. This was announced back in September 2019, really as a response to a number of issues about how well the 2014 reforms had been embedding themselves. So we wanted to look at how the SEN and disability system has evolved since 2014 and to try and work out whether we can do better at making the system work across the country equally well for all families and ensure that provision is of the same quality. A particular focus is the role of health and social care in SEN and disability, working closely together and recognising the importance of joined up work. So really the review is looking at those angles. It's considering these elements of the system. Improving clarity for parents and carers is of particular importance. And also you'll notice that we want to look at the issues around the incentives and accountability for schools and colleges and local authorities to provide the best possible support. Do the incentives, does the accountability, do they work? Are they all firing on all four cylinders? Many of you, if not all of you, are aware of the rise in education, health and care plans over the last 3 or 4 years. What's behind that? So let's try and get underneath that and see whether it's a valid rise or whether there are issues that need to be resolved behind it. And of course, at all times, we are looking to ensure that public money is spent in an efficient, effective, and sustainable manner. And that includes all 3 key agencies involved in education, health, and social care. The review process, it is a DFE-led review, but it is cross-government. Many government departments are contributing to it. It is seen by number 10 as a very big priority. There you can see there are 3 independent advisors who are providing support to it, and there is engagement with internal and external stakeholders. So it is a very big process and will be reporting at some time in the future. So let's turn our attention to the subject of the day, that is the national trial. And what was the aim of that? Well, the aim of that was, as the intentions behind the 2014 reforms were, to create a more holistic, person-centered view of the child or the young person's needs. And the whole system was devised to do that. What we didn't do at that time was to bring the appeal rights in line with the wider remits of education, health and care plans. So although the plan is about education, health and social care, if people are unhappy about aspects of it or there are disagreements, there are different ways of resolving those, of making complaints at the moment. So there are 3 different routes of redress, one of which, of course, is to the tribunal historically for those issues around educational matters. But does that make sense? Is that right for families? Does that encourage joint working, or does it make that an even greater issue? So we were committed to looking in more detail about this. We also wanted to see whether bringing the system together in terms of redress would bring about positive benefits to families. So it was flagged up early that we would be looking at how to do that through a single route of redress, and that was why the national trial was set up, to see what difference it would make being able to make an appeal about all 3 matters to a single body. And the key features were that really prior to the trial beginning into April 2018, if you wanted to appeal to the tribunal, you could only appeal about the educational aspects. That's sections B, F and I. Separate routes of complaint were required for health and social care. So the trial was set up, and under that trial, the tribunal has powers to make non-binding recommendations. So recommendations they can make, but they're not statutorily binding. They are about the health and social care aspects of local area decisions concerning education, health and care plans, but they will always be part of an education appeal. We'll understand more about the issues around non-binding later in this webinar. Let's turn now and remind ourselves of the roles and responsibilities of each of the parties involved in this process, starting firstly with the local authorities. When making decisions in relation to the education, health and care needs assessment and the issuing of a plan, these are the decisions which apply to the extended powers. As you can see, it's pretty much all decisions that local authorities make, apart from the initial decision about whether to assess in response to a request for an EHC needs assessment. That is not included because the criteria for that, the legal framework, is around educational needs and educational provision. But of all of these decisions, whenever a local authority informs a parent or a young person of their decision, then they must tell them about the extended rights. They're also required to include details about the extended rights in their local offers. And that does seem to have happened now. It was a bit slow taking off, but there does seem to be information on all local offers now. Local authorities must provide evidence to the tribunal when requested to do so, but they must provide evidence from health and social care. So it's the local authority's responsibility to make sure that happens, and to make sure it happens within the timescale set down by the tribunal. Local authorities can seek permission to bring additional witnesses. That doesn't mean that the tribunal have to agree to additional witnesses. And another important part, bearing in mind this is a trial and subject to independent research, there is a responsibility on local authorities to send the health and social care responses to any recommendations to the independent evaluators. And there you can see the email address. Even if you haven't been doing that up to now, it's not too late to start. Please do make sure that responses are sent to the evaluators. Thank you. Health and social care commissioners also have a range of roles and responsibilities under the trial, including responding to any requests for information and advice, including sending a representative to attend the hearing if requested to do so. And the response on receiving any recommendations must be made within 5 weeks. So that includes all health commissioning bodies. What progress has been made? Well, there's been a lot of activity going on. Certainly there's been a lot of support available. There has been a previous webinar, there have been newsletters, and lots of briefing events. There's been a help desk, FAQs have been in place. These are all available on the National Trial Toolkit. You're probably aware that back in November 2019, the then Minister of State, Michelle Donnellan, announced an extension of the national trial to August 2020. It had been initially set up for 2 years and would have finished on the 31st of March, in fact, in a few days' time. But we wanted to make sure that we had spot-on evaluation in order to inform ministers' final decision about extension of this national trial. So a decision was made to prolong the national trial, and so that is now continuing until the end of August. I've already alluded to evaluation. There is independent evaluation going on. It's almost complete, but that will inform feedback from the National Steering Group, will inform a minister decision. Local areas have got 3 months now in which to claim expenses. And a reminder that you can claim up to £4,000 per appeal. And the next steps really, ministers will make a decision about whether to extend the provision in the trial, or really whether to make them mandatory for all local areas. A reminder about local area expenses. Local areas and CCGs can be reimbursed for reasonable expenses. It is the local authority who applies for those, and in fact there haven't been that many requests for expenses being put forward. A total of 46 have been received since the trial launched. There is more information about that on in the toolkit. Where's evaluation up to? Well, we've had a lot of activity from the evaluators. There have been preliminary in-depth interviews with a number of national stakeholders, and 12 local areas across the country have been visited to explore the local area experience of the national trial. There have been interviews in those places with SEN leads, with CCGs, with DMOs and DCOs, and others. There's also been a survey of appellants, survey of those individuals who appeal to the tribunal about the extended rights, to find out their experience of the process, how well it's gone for them, what have been the challenges, what have been the costs. We've also analysed those recommendation letters that have come out from the tribunal, or at least we've analysed the responses that health and social care commissioners and local authorities have made to the recommendations. There's been an online survey about the costs data from local authorities and CCGs. And there have also been some cost case studies comparing the journey of individual cases in some depth. And there are plans to do some follow-up surveys of appellants to the system. So again, the evaluation is fairly extensive and reaching the end, but not quite concluded at this point in time. There will be an evaluation report coming out later this year. It will focus on the impact of the Redress trial on children and young people's health and social care outcomes. It will look at the impact of the process for families. What's been the difference that's made to them and the impact on their lives. Equally, we want to look at and report upon how the trial has impacted on local authorities and CCGs, the workloads, the costs, the ease of access to the system, and so on. There will inevitably be a focus on the additional costs associated with the trial, additional costs for health, social care, and appellants, as well as trying to make some sort of evaluation about the value for money of the extended rights system. And of course, we want to find out whether the trial was implemented as it was intended. Were the rules of the system followed, and what wider learning is there? And finally, guidance and toolkit. Well, these are hyperlinked, so do click on them. The guidance document is very detailed. The toolkit has got a number of helpful items in it, including templates, FAQs, previous webinars, etc. And a reminder that IASS, support service, advisory support services, and voluntary sector are able to provide support to families, sometimes just by disseminating information about the existence of this right. Sometimes they are supporting the preparation of cases and even at times supporting families at hearings.
And we now move on to an update on the national trial presented through the Judicial College perspective. The national trial, as we know, started 2 years ago in April 2018, and it gave powers to the first-tier tribunal to consider issues around a child or young person's social care needs or provision, or their health care and needs or provision, or both. The intention is that it still remains education focused, that there must be education issues, and that in dealing with any appeal, the first-tier tribunal decide on the education issue first, and then make a recommendation in relation to the issues under dispute in relation to social care or health. The first-tier tribunal is making recommendations on these two areas. These are not orders, which differ from the education side of the appeal. And again, parents and young people are able to make appeals about all decisions in relation to education, health and care assessments and plans, apart from the refusal to assess decision, which is in law primarily about educational issues. When the national trial began, there was an estimate put forward from the Department for Education that there would be around 350 appeals over the course of the national trial. The national trial has been extended to the end of August, but in fact, as you can see from these statistics, by the end of January, that's 21 months into the national trial, the number of appeals to date, 1,566, does exceed the original estimate. When we look at the breakdown of the sources of appeals, the majority, around 2/3, around 3/4 probably, have come from the child or their parent, whereas 383 have come directly from a young person themselves. And of these appeals, we can see that, and remember, all of them must have an education component. But on top of that, around 838 are about health and social care, in addition to educational elements. 354 are about health only, and 310 are in relation to social care. So the largest area is about education, health, and social care. And so far, a number of outcomes have been recorded from all of the appeals. In 367 cases, a decision has been issued on 79. 79 have been withdrawn. 44 have been conceded, and there have been 391 consent orders. That is, orders agreed by the first tier tribunal with agreement with the parent and the local authority. Only 3 have been refused registration because they don't fall within the parameters of the national trial, and 25 have been struck out. Some other interesting statistics: 84 appeals actually became national trial appeals once they were registered. When they were first appealed, it wasn't clear precisely what the grounds for appeal were, but in clarifying that, the case management system within the tribunal determined that they were actually about wider issues than just education. 13 of the appeals actually moved from one local authority to another during the life of the appeal, so it was down to the new local authority to decide on the matters in the appeal or whether to proceed to a hearing. 309, quite a large number, were actually stood down, and 10 were stood down twice. 45 have been determined just through paper hearings, and 130 have been adjourned. And the main message by January: it is not slowing down. There have been in recent months an average of 70 appeals to the national trial per month. So that is a considerable number and above the original estimate. So what are the processes for dealing with a national trial appeal? Well, there are differences from the usual process. There are bespoke registration directions, identifying the issues across the appeal. So when an appeal is received by the tribunal, there is a very clear process for identifying exactly which areas are subject to appeal. And where there are, on the odd occasions, urgent requests, these are looked at by a registrar or a judge very promptly. There's a case management review after the final evidence deadline. So where the evidence is finally submitted, there is a distinctive case management process for determining the next steps in managing the appeal. And what have we learned? In relation to social care, what have been the top issues that the tribunal have faced? Well, rather surprisingly, or perhaps not surprisingly, many of the appeals have boiled down to a request for a social care assessment. There is a debate as to whether we really needed a national trial appeal for that to be unearthed. There have also been issues around carers assessment, which in part relate to the first bullet about the social care assessment. There have also been issues around direct payments for social care provision and for respite support. Another issue has been provision in relation to personal assistants or key workers or mentors to access local community activity, youth clubs, sports events, and so on. There's also been quite a lot of cases which have involved planning required for transition to adult social care. So a number of cases around the 16 and 17-year-old level, which is looking at that transfer to adult social care, including personal budgets, and I think a concern about lack of confidence in local systems for planning for transition. And also, there have been issues the tribunal has faced in relation to social work contributions, basically to the education, health, care review process and the planning meetings. And too often there are still education, health and care plans being produced which say no social care advice and information. Clearly, the Children and Families Act does require social care advice and information. There have also been a small number of cases where one of the issues under dispute was the placement, and in particular a request for a residential placement, and issues around social care being part of that. And the tribunal has questions that it considers when dealing with these cases. In relation to a residential school or college, the need for a waking day educational curriculum to meet educational needs. So to what extent is that the primary factor in the case? Or secondly, the issue about a combination of a child's or young person's educational and their social care needs. So how do these combine to make a requirement for a package that is a residential school or college? On the health side, what are the top issues? There have been quite a number of cases in relation to children and young people's mental health needs, and therefore there have been quite a number where we've had to look at CAMS, Child and Mental Health Service assessments, in particular provision being made through cognitive behaviour therapy. We've also had to look at issues around occupational therapy assessments and provision arising as a result of that. Nursing support for young people with diabetes or tracheostomy care has been quite a common issue in a number of the cases. And then we've had quite a few cases where there's been quite a debate about physiotherapy sessions for health needs, whether or not that is educational provision. And going back to the basics around health provision or special educational provision, we need to remind ourselves that any provision that educates or trains is usually regarded as special educational provision. And finally, another big issue on the health side has been toileting and personal hygiene, and that has been quite a big issue as well. The tribunal has published a summary of a number of decisions made between September 2018 and March 2019. These are available at this link, and it is well worth reading these. They provide a lot of detail on a number of very interesting cases and useful learning for all. So what have been the primary issues that we've learned? Well, identifying the issues when the case comes in at registration does help improve the local authority's response to the appeal. The earlier we can engage with local authorities when an appeal is heard and focus in on the issues at hand leads to better management of the case. Also, the case management system before a hearing, when we've received all of the final evidence, that also helps manage the case smoothly, and it does reduce the number of adjournments in appeals, adjournments sometimes being needed because, unfortunately, further evidence is required. Telephone case management as well helps result in a higher rate of settlement. We do find a number of cases can be resolved through telephone case management, where all the parties are in telephone contact managed by the tribunal. So some observations from the tribunal in relation to the national trial. Well, probably the strengths of the national trial. It is bringing about a much more holistic consideration and decision-making around the whole needs of the child and the young person. It is helping to provide a much more complete picture of the young person's needs and provision. And we have seen evidence of a change in practice in local authorities. There's much more collaborative working between education and health care and social care teams. It has helped to bring the child and young person to the attention of social care. Clearly, we would have liked and expected this to be happening long before an appeal was needed. Nevertheless, the process of appeal has brought those parties together to consider the needs of the child or the young person. And we also feel that it has been helpful in terms of providing access to justice and a more balanced approach. The parent or the child, the parent or the young person can challenge social care and health decisions at a one-stop shop. That was part of the intention behind the trial. It was clearly part of the intention behind the Children and Families Act reforms, that as much as possible of the child's whole needs and provision were considered as one package. On the weakness side, well, the tribunals had challenges in relation to the level of resourcing it has, particularly given that the number of cases has exceeded those predicted. Local authorities have also faced the same sort of challenges, as have their health partners. And there's very little legal aid available, and also apparently insufficient free parent and young person support at local level. There is continued lack of coordinated working in local authorities, particularly between local authorities and their CCGs. And another weakness is that families have found that they can only challenge on social care and health issues via the tribunal if there is an appeal regarding an educational issue. This was the intention behind the reforms, but many have put this forward as a weakness. And then in relation to the future of the national trial, the questions that we're all facing are, should the jurisdiction of the tribunal be further extended? Well, clearly a decision has yet to be made. Should the powers to order or recommend on social care issues become part of the permanent SEN landscape? So 2 decisions there. And also the same for health. Should the tribunal have the power to be able to order on health issues? Should it have the power to recommend on health issues? Or should we go back to the current system? And these will be partly answered through the extensive evaluation that's ongoing. In phase 1, there has been a number of in-depth interviews with national stakeholders. There have been baseline and follow-up case studies with a number of local authorities. National trial appellants, people who've appealed to the national trial, have had a baseline survey. We've also been able to analyse the recommendation letters arising from the tribunal decisions. There's been an online survey to collect cost data from local authorities and CCGs. And we're grateful to those who have contributed. And there have been a number of cost case studies looking at the actual costs of individual cases, both the administration of them and the costs associated with recommendations and decisions arising from national trial cases. So there's a likely follow-up where there'll be a further interview of national trial appellants. Around 6 months on, to just look again at the extent to which they are actually feeling satisfied with recommendations and the extent to which they felt that the issues were resolved in the longer term, and the extent to which they feel that provision has actually improved since the tribunal hearing. Also, a phase 2 evaluation report will be looking again at the local authority and CCG cost surveys to collect much more updated cost data and fine-tune exactly the costs of the whole system. So what next? Well, the first evaluation report is going through the process of finalisation. And sometime after Easter, the government is likely to respond to the continuation of the extended powers, and the projected date for the national trial finishing is the 31st of August this year. Thank you.